Hello and welcome to Cadabams Insights, where real conversations about mental health happens. The interesting things that you're talking about, the traits, I think if we can little more, dwell into those traits. What is Satvic personality, Rajasic and Tamasic, how do you identify who has got what kind of traits? If you could little elaborate on each trait and then also help us each trait, how do you work and addiction related problems, it will be very, very helpful.
Okay. Essentially the three words. Tamas means darkness.
Okay.
So these are people who are more into lethargy, dull, depression for that matter. Just to give you an example, again from mental health context, what is the state of mind if somebody is anxious or depressed? Both are thinking a lot.
Yes.
But the way they think
Is more negative.
is very different.
Yes.
Anxiety is expressed in terms of hyperactivity, whereas depression, the same flow of thoughts is going dull. So that's the typical difference between tamas, which is lethargic, and rajasic. Rajas is coming from the word raja.
Okay.
Raja is the king. How should be a king? He should be energetic. He should be dynamic. Okay. Say, we have a cup of coffee to get an energy. We just had one. Okay. But imagine instead of one cup of coffee, we have 5. We suddenly restless. So each one of these traits, we need to sleep, which is lethargy. It is required. Too much of it is a problem. Okay. So each of these traits, there is no bad or good there.
Okay.
These are components of our life.
All of
They should be very bad. They are there in everybody.
Okay.
The thing is that each one of our personality is a combination of it. Okay. Sattva is more equilibrium, poised person. Okay. Now, if I am coming here and putting my flow of thoughts in front of you, I need to be active. I cannot be lethargic. Okay. But I need to think it through before I talk. So it's a combination of Rajas and Sattva which is working there. Okay. So it's always this combination that we are talking about. Now, typically a Rajasic person is, my life, I will do whatever I like.
Okay.
Okay. There are people who are addicted because they are very nice people. You would come across a lot of people who are very nice otherwise.
Yes.
Okay. And they kind of are seeking that meaning in everything. They are trying to find meaning in everything. And they're like, "Arey yaar, isme to kuch nahi hai. Why I should be doing all this? Chalo,
I don't know, have a drink.
Okay, a very Satvic approach to alcohol consumption.
Yes.
Okay. There are people who are doing it because they really want that kick.
Yes.
In typical
Which is more
language, Rajasic way of doing it. But there are people who are doing it because, okay, I don't have anything else to do. A Tamasic way of doing it. So it's always a combination of these. Now, a Rajasic person would require a little more calming. They may require a little more counseling. They may not be listening to you quickly because they are very dynamic. Okay. So engaging with them at their pace and then calming them down is important. But somebody who's in, say, a stumber, you need to really work with them to make them active. And the way it is told in philosophy as well, you need to shatter the tamas using rajas. But rajas, too much rajas is also bad. So you need to move to sattva. So that is the path that is taken.
How do you assess that, who has what kind of a trait? Or, I mean, as an individual, we are probably very pleasant, calm to begin with our day. As the day goes by, we become super active, and by the evening or night, we are dull. So that is where I want to take something so that I become active the way I was in the noon. So in a day itself,
There are phases.
there are phases that we go through, days that we go through, month, there are variations. So how do you assess that this person has this kind of a personality trait?
One is the clinical history. I mean,
Are there any tools?
yes, there are tools. There is a Guna questionnaire which is validated. That is Vedic Personality Inventory.
Okay.
So it has a set of questionnaires about, like, a question that I would say is, what do you like to do when you are in leisure time?
Okay.
Okay. What would you like to eat? And I have
Okay.
things that are described there,
So which are related to the
which are related to your personality.
personality trait. Okay.
So and there are a set of questionnaires, and then ultimately you have that combination of, okay, this much Satvic, this much Rajasic, this much Tamasic, and the goal is to move in that direction.
So you're saying, of course, nowadays people do recognize, understand, talk about, I know this is a time I like to have only Satvic food, but not sure people ever talk about Rajasic and Tamasic food. People are familiar with, Satvic food. So you mean that the food that we have can have an impact on our trait?
Absolutely.
Can you little more elaborate on that?
I give you example of coffee.
Okay.
So if you're looking at the classical explanation, which comes from the Gunatraya Vibhaga Yoga of Bhagavad Gita, you have 3 shlokas,
Okay.
each dedicated to one guna and the food that they love.
Okay.
Okay, so it talks about how, and what does that bring in?
Okay.
Okay, so typically somebody who's Satvic, he likes fresh food, wholesome food, not very spicy, not extremes of taste.
Okay.
Fresh, wholesome food. And that brings in Ayu, which is long life, Sattva, energy, okay, Bala. Whereas somebody who's Rajasic loves extremes of taste.
Okay.
Okay, because that brings that energy, right? So you have, say, if I have to give example, with all due respect, Andhra style of food.
Yes.
Okay, where you have extremes of food,
Yes.
flavors.
Yes.
Okay,
Spice, sour.
exactly. So that's typically Rajasic.
Yes. In our own Karnataka, the North Karnataka, we is very spicy.
Exactly.
Find
Exactly.
yes.
Okay,
Compared to the Bangalore,
which is very Satvic that way.
yes,
Less spicy and sweetish in flavor.
yes.
Now, Tamasic people, they basically dwell in foods that are stale, pungent,
Okay.
in fact, over fermented. And that is where, very interestingly, today's concept of nutrition, we always talk of food gives you energy, calories. So after a full meal, you should go more energetic, yeah?
Yes.
But that's not how it happens.
With every food,
No, you start feeling well after that.
yes.
And that is because there is something more to that calorie concept. And that is where the essence of food is very important. So, very typical example I'll give you. It is said that over fermented foods are tamasic in nature. You have dosas which are made from a batter which is a little over fermented. Almost instantaneously.
You dose.
You doze off, or you're very dull, you're very tired. So that is the nature of food. And it's very quick. Okay. So if, say, I am consistently eating some good food, say Satvic food for that matter, the way it works is that it is going to change my gut microbiota. Okay. And when the and Today's science is telling it is not you who is craving for food. It is your bacteria which are craving for food.
Yes.
Okay. So I am systematically changing that. By providing a certain kind of food, then things would change.
Okay. So, in terms of diagnosing, as we understood, you look at the personality trait, Satvic, Rajasic, Tamasic, and then I think you also spoke about the Panchakoshas, where the mind being one of the sheets, while taking into consideration the first basic, the Annamaya Kosha, I think Taittiriya Upanishad, wonderful example you brought in. So when these patients, people with substance or alcohol related problems, when they are there, what are the treatments as such, in terms of the prescription? From a modern medicine context, you diagnose and then you give medicines, which has got its own basis. Second, there are psychological therapies, there are family interventions, and various treatment options that is provided.
Absolutely.
So from a yoga and naturopathy point of view, okay, what are those divisions or treatments that is there, like yoga, diet, and what else are there?
One will be the yoga therapy component of it, where we go with more customized modules. I was talking of yogic games to you. I was talking of doing the yoga practices in a more dynamic manner.
Okay.
And again, then gradually introducing a little more calmer, relaxed practices over a period of time. Then you would have, it would start with rapid breathing.
Okay.
But then the ultimate goal would be to slow it down.
We would get into the yoga part of it. So yoga is one, and second, from the natural
Food is definitely, I had a lot of it, very important. But in naturopathy, we will use hydrotherapy.
Okay.
That's again the use of water in therapy.
Okay.
We use massages.
Okay.
Again, use aroma while massages are given.
Okay.
We use mud.
Okay.
Mud application.
Okay.
Both for metabolic as well as detoxification processes.
Okay.
Acupuncture can be something that can be very useful for withdrawal.
Okay.
Typically the headaches and sleep issues and all of that. So you have acupuncture.
So in terms of different treatment options that people can experience, is one is yoga, diet part of it, where again it has got an impact or influence on one's mind and the trait that we just spoke about, and then water as a treatment methodology, or a water being used for treatment, and then mud naturally available being used, and then the acupuncture. Yeah, I think it looks like a huge or a large area. Treatment options that people have. Can we get into each one of them?
Yes.
And help us go through, understand, from yoga, what are all that people can do or should do, and what do you prescribe?
Well, it will be a set of asanas. The goal is actually to bring the awareness back to the body.
Okay.
Today, the problem is the moment I dissociate with my body, I have cravings. I run away. My mind goes to what I really want to take. So, bringing that focus back. So, add a component of chanting, add a component of breathing when you're doing the practices. Initially, the mind is very quick to respond. So, quick to run away. So, you make it more dynamic. Make sure that your body is tired.
Okay.
So that you are able to bring in that component of relaxation. Pranayama, breathing, my own work had been on breathing, and I think the most intriguing physiological system that we have in the body, all other physiological systems are either voluntary or autonomic. It's the only system which is both autonomic and voluntary, and that is where we bring the voluntary control on breath to control autonomic nervous system. So lot of pranayamas in terms of whether it is bringing in Nadi Shodhana, where you're balancing the breath, but that is known to balance the autonomic nervous system. You bring in chanting like Bhramari, okay, which includes, now we have studies where there is a nitrous oxide that gets secreted, which is again a relaxing this thing. We do have studies which tell us that you do yoga, endorphins are there.
Oh,
okay. So basically, why are you going to a substance? Because you ultimately want to feel calm.
And naturally
endorphins are there. Okay. We do have studies where we're talking of the reward pathways, which is again a major issue with addiction.
Absolutely. Yeah.
You are going back to the substance because that reward pathway needs to be triggered.
Yes.
But we are talking of naturally synthesizing that dopamine, serotonin, those happy hormones, and making sure that you don't require that external substance for going back to that. Once you are a little more calm, we would definitely want you to go more with mind modification. So, lot of meditation, counseling, and all of that.
So you're saying the practices of asana and pranayama, they in turn have an effect on the neurochemistry of the brain.
Absolutely.
You're talking about the endorphins, the dopamine, great. So there are studies being done on these things?
Yes.
Okay.
In fact, there are numerous studies, and the most studied among yoga practices would be meditation, second would be pranayama.
Okay.
Across the basic studies that are there.
Okay.
But when it comes to therapy, it's more integrated. They have asana, pranayama, meditation components to it. What we know is that you don't really require a long duration of practice for these neurochemistry changes to happen.
Oh, okay.
Anxiety is, and you would be a better person to talk about it, happens because your thalamic GABA levels go down.
Yes.
You have that inhibition is lost. Yeah. There are studies that one session of 20 minutes increase thalamic GABA levels.
Oh, okay.
Okay. So we're not just talking of, I have to do yoga for these many hours every day for these many days.
It is as quick as
probably a drug. Okay. And you suddenly start feeling very calm immediately after that session. And then probably you will go back to yoga, which is more holistic, more comfortable to go back to that reward pathway than going to a substance. Okay. So that is definitely there. Hydrotherapy or mud therapy.
So just about the yoga, if you can, little more, if you can explore. You spoke about not just the asana and pranayama, which is important. You also said the Ashtanga part of it, where
meditation part of it, discipline part,
the discipline, yama, niyama.
Absolutely.
So how do you prescribe them? See, in today's world, the biggest challenge is, it's easy to say you speak the truth, but
how do you do it?
How practical it is to be speaking the truth, it's and of course things like ahimsa, you don't want to trouble anybody, you don't want to be troubled. Yes, practically possible. But how do you prescribe to a person with addiction?
One of the things, key things is to be aware that there is a problem. And I think you would agree with that the moment you understand that there is a problem, it will get resolved.
Yes.
It will start towards resolution. So counseling is a major part of what we do. Just to give you an example, probably absolutely unrelated, something that happened. I drive a motorbike.
Okay.
And I used to work in Pune. My director once wanted to go to a bank which was a couple of kilometers away. So, and parking was a problem. So he said, Apar, will you drop me? I said, why not? I took him, brought him back, and then after coming back, he says, Apar, are you not confident of your driving?
Okay.
Yeah. I was spooked.
Okay.
This is not, I have been driving for a while. So, sir, why do you say so? No, it's just a couple of kilometers and I heard you honking the horn for about 10 times.
Okay.
That happens only when you are not so confident. And suddenly I was aware that I was honking the horn. Till then, I didn't know that there was a problem.
Okay.
Okay, and then gradually there is a change. Today, I don't use the horn
So much.
So similarly, there is a lot of counseling that is part of it. And I think any addiction recovery, that support system has to be there. And that is where it's not just in the form of a lecture that, do good things, don't tell lies. No, not that. But extracting things from the patient's life, that see, this is where probably you could have done this differently.
Correct.
And then that awareness would probably bring in that change.
We ourselves, when we do something which is good, you spoke about the reward pathway.
Absolutely.
We ourselves feel so good that, yes, I did something, which satisfies us.
Absolutely.
Naturally. When you do something wrong or bad, you're not comfortable.
You're not comfortable.
Okay. So I was curious to know, how do you prescribe, how do you make suggestions so that this person as a patient who is there with you can adopt those things and stimulate or, have his normal reward pathways being,
One of the things that Guruji, Dr. H.R. Nagendra always tells and suggests to everyone, not just to patients with addiction, is do one good thing every day.
Fantastic.
And again, this comes from Bhagavad Gita. It says, offer something. Okay? Phalam pushpam patram toya. Okay? Whatever good you can do, start doing one good act of service every day. And it becomes a habit. Note it down somewhere. So, that is a prescription in a way.
Correct.
Okay? So something similar.
Are there any specific asanas and specific breathing techniques which are supposed to be helpful for people with addiction, alcohol?
Asanas, I would not say there are any specific practices. You will have to, again,
it's like it's
the whole person. And that is why, again, with pranayama as well, I will not say that this is the pranayama. I mean, this is not a medicine that is working on this thing. You're overall looking at an individual doing things. The focus on asanas is about making sure that...
How do you suggest, in this? There is a patient, on what basis you suggest you do this asana, this pranayama?
So, the asana or pranayama prescription essentially is made based on the requirements. The ideal combination, I would say, of asana is to bring spinal movements in every direction.
Okay.
Forward, backward, sideward, and twisting.
Okay.
Now, there would be people who would probably come with a back pain. They may have a comorbid hypertension. They may have some other comorbidities. So, things that we should avoid in those comorbidities, we avoid. But by and large, your prescription is pretty simple.
Okay.
That you should have component of each one of these practices. And they can be done in standing position, sitting position, supine and prone position, etc. The focus is actually bringing awareness to your body and giving deep relaxation.
Okay.
So that is why it doesn't matter what asana you're doing. Okay. Whatever people like. But I said the component of dynamism has to be there when it comes to addiction, because that keeps them focused on their body rather than drifting away. Pranayama, again, we recommend Kapalabhati, which is not a pranayama, it's a preparatory practice from the cleansing processes. Okay. Rapid breathing, again, helps detox, number one, but also bring that autonomic balance. We keep talking of autonomic balance so much. But also, my own study, I looked at response inhibition as one of the components with breathing. Okay. No, breathing in general.
Okay.
And the inhibitory control is something that is lost with people with addiction.
Addiction, yes.
Pranayama helps you have that.
Oh, very interesting.
So, of course, I did not study people with addiction. I had healthy people. But what we are saying is something that we could find in healthy people can be applied in therapy as well. So, you have the Nadi Shuddhi Pranayama, you've got Brahmari, you've got the components. And you need not know the technical nitty-gritties. It is just focusing on breathing. So I can just do abdominal breathing, slow it down. I can do a thoracic breathing, a clavicular breathing. It doesn't really... In very fundamental ways, you need to slow down your breath. Make sure that your exhalations are longer than inhalations. And
Hereby,
the rest of it,
the parasympathetic, activation happens, and your
vagus gets activated and all of that. So that is definitely there.
So the prescription as such of asanas and pranayama is with the specific understanding of the person and the condition, plus also the trigunas or the personality traits, personality traits, that you spoke about. Is there scope of the other domains of Ashtanga Yoga, the Yama, Niyama, Asana, I think Pranayama? There is other deeper aspects of meditation that we are speaking about. Are they also prescribed, or do they have a role in addiction?
Yes, absolutely. I mean, ultimately it is because my mind is not under my control that I get addicted. Correct. So the goal is to have that mastery over the mind. And while asana pranayama help, nothing can be better than dealing with the mind directly.
Yes.
Which is the meditation part of it. So we do have multiple meditation techniques, and not only at our center at S-VYASA, across the world.
Yes.
There are different approaches to meditation that are followed, but all of them kind of benefit. We have something called a cyclic meditation, Avartan Dhyan, that we have devised.
Guruji
has worked on. Yoga Nidra from Bihar School of Yoga, which is a traditional practice of yoga. Today, in the West, if you're looking at the literature from the Western world, you will find a lot of MBSR, mindfulness-based stress reduction technique. So, essentially, the core of it is the same. You're working with the mind. The way you do it is a slightly, you use body as a media, use breath as a media, you use a mantra as a media. But ultimately, your goal is to calm down the mind. That is what you do in meditation.
So, the second aspect, I think the most important, and probably many would be interested, is about the diet. I think you did touch upon saying that the type of food also determines the type of personality and how your mind works. So help us. What are the foods that we should avoid if I don't want to get into addiction? If there is already a person with addiction, what are the foods that might help him to overcome them?
Okay. Again, going back to Duryodhana's example, I think nobody needs an actual advice on food today. All of us know what is right, what is wrong. Just that we don't follow. We just have to follow.
Yes.
the fast food essentially is something that you must avoid, because that in itself is addictive.
Yes.
I mean, we don't know that reward pathways work with food as a major component. So, that way, I think one major thing to avoid will be fast food. The second thing would be processed food.
Okay.
Whether it is sugar, it may appear like a very generic suggestion that sugar, salt, maida, white rice,
The polished rice.
rice. But the deeper connection to that is probably one with gut microbiota. We're talking of low fiber. Your gut microbiome is changing and then
leading to dysbiosis
and all of that. The second part of it probably would be, so if I don't eat that, what do I eat? So things that are fresh. I go back to the definition of Satvic diet as a wholesome. The traditional food that we have had always is more holistic. I would say seasonal, regional food, because we are in Bangalore now, and the place where I come from, otherwise, we don't have ragi in our place. Okay. But ragi is grown in this place because this is relatively cool almost the whole time, and ragi is a warm food.
Yes.
Okay. So that seasonal component of it, the regional component of it, is actually something looking like a very generic idea, but a very important one. I would not say eat coconut because it is good for you. Eat coconut in the areas where coconuts are grown. It will be good for you. But one simple component of food is processing. The more we process the food, it becomes nutritionally bad. But also today, the biggest addiction, we are talking of addiction today, and interestingly, we talk of substance abuse, we talk of, tobacco to alcohol to, narcotics. But food is the biggest addictive.
Yes.
Okay. So, and processed food is the biggest addictive that is there. So, I think if we are changing that, it should help a lot.
What do you say? This is one of the probably the most controversial, statement. Your opinion on non-vegetarian food, which I find surprisingly people with substance abuse, alcohol or even other drug abuse, they're craving for non-vegetarian food and wanting to have non-vegetarian food and fried items is much. I don't have a scientific backing, but this is my own experience and observation.
Absolutely.
I know that I have. So what is your suggestion?
Looking at yoga, definitely no.
Okay.
By definition, this is the Tamasic and Rajasic kind of a food. So it is leading to that kind of a situation. But also, I have other reasons than the philosophy.
Okay.
The reasons are more to do with the medical component of consuming non-veg today. One, I think we are not programmed. Our body is not programmed to consume non-vegetarian food. You look at the structure of the body, whether it is the jaw, your stomach acids or the length of intestine, we are more herbivorous than carnivores. We always talk of during evolution we ate non-veg. Yes, it was necessary then. Today, with the abundance of food, you don't really
and all the evolution that body has gone through.
Yes, yeah. The second part of it is definitely, I think, the hygiene. Absolutely unhygienic conditions these animals are put, whether it is poultry or dairy,
yes,
or for that matter anything else. So that is another component. Irrational use of antibiotics is there.
Yes,
and
lot of
antimicrobial resistance and
yes,
all of that. irrational use of a lot of hormones.
Yes.
Whether it is oxytocin for rapid growth and all of that. I don't know if you come across poultry farms. Kanakpura Road has many, I believe.
Yes.
You would see that even at night, there are bright light
To the
chickens, because they need to grow fast and give eggs, lay eggs more fast. But imagine the kind of hormonal status, the biochemical status of that chicken. That is what we are consuming. That is under tremendous stress. The same stress when we consume, we get into.
Yes.
Okay. So yeah, there is a philosophical component of Rajasic food, but that is actually so real today with the biochemical and neurochemical pathways. Definitely a no-no.
Yeah. Thank you for that. I don't know how many of the viewers, listeners would like that suggestion and like to follow. The other treatment modality that you spoke about was using of water and mud. Okay, so they are so natural. I mean, every day I take bath, so I'm using water. How differently you use water for treatment. Of course, our touch with the soil is, we have lost it. Unfortunately, we have lost it. But how do you use them for treatment, and what kind of treatments are advised for these addiction patients?
Let me give you an anecdote on what you just said. We take bath every day. The kind of impact that water can have is just unbelievable. You wake up in the morning and you want to freshen up. What is the way you use water? You typically take some water and splash it on your face. What is the temperature of water?
Yeah, room temperature.
Cold.
It's the tap water.
Yes. But you have had a very hectic day and you want to relax. You take a shower in the evening. What is the temperature of water?
Maybe a little warmer.
Warmer.
Yeah.
Now, you have learned that I take a warm bath and you take it for a longer time. The whole body is used.
Yes.
It allows you to relax. Okay? Even at the level of your brain,
yes,
it allows you to calm down. Whereas the same water used on a very specific part of body, you don't really splash water everywhere. You just only wash it on the face at the cold temperature. A very different application. Has an exactly opposite response. So that's the whole idea of hydrotherapy. Okay. The reason in naturopathy we use water so much is the flexibility that it allows us to use. You can use it in different forms at different temperatures, with pressure, without pressure, directly, indirectly. You can use it using a towel, you can use it, pour the water or use a shower. So many ways. So say I want to stimulate somebody. I'll typically use cold water in shower form. Okay. I want to make somebody relaxed. I would go for a prolonged warm to neutral temperature application over a period of time. Okay. That is again dependent on what is the condition. Somebody is aggressive. I want to calm them down. I would use water in a specific way. But somebody is, very drowsy. I want to activate that person. I would use water in a very different way. Okay. Water can have profound impact on our neurological and the whole body that way. It would be quite difficult for me to just tell you that I would use this type.
From a broadly, we got it. Broadly, the temperature of the water and different parts of the body, you prescribe and use it depending upon the clinical condition and the requirement.
But I have somebody with some say liver involvement, I want to stimulate liver, I would go with a local application on the abdomen. I want to stimulate somebody's digestive ability because they are not able to eat, I would go with something very local.
So, how do you use mud as part of the treatment? Where do you apply, or how is it effective?
Again, one in very generic terms, detoxification.
Okay.
Of course, with the de-addiction, detoxification is a very important term, but we use it very commonly.
Yes.
Skin is a very semi-permeable membrane, and we don't use it as much as we should because the kind of exposure that we have with skin, largest organ in the body.
Yes.
So if you have a media which can actually pull things out, and so that is where mud can be very useful. We use a direct application. There is a fantastic application called mud bath, which is very nice. Even otherwise, I mean, you need not be having an addiction problem to do it.
Okay.
It's a very nice health measure, but also improves circulation across the body, brings in a lot of detoxification, but also what it does is it stimulates the metabolic activity because you are exposed to a cold temperature for about 30-40 minutes over a period of time, whole body. So now you have brown fat activation, you've got, so there are multiple pathways with which it works, but also mud can be used locally, like you have application on the abdomen if you want just the metabolic activity of the abdomen to enhance, or the spine if you want to calm down. If there is a painful part, there is tremendous amount of evidence in terms of pain management and mud therapy. So you use warm mud on local areas for pain management. Can be used in
like water, the mud also used so that different parts of the body depending upon one's requirement or condition.
Yeah.
As we spoke from a yoga and naturopathy system of medicine, you don't look at addiction as one brain small area problem. It's a person and the family that is going through, and you would like to address it. I think the next one that you said was acupuncture, that you spoke about. So is it invasive that you puncture something?
Yes, it is invasive.
Okay.
There are two ways. Acupuncture and acupressure.
If you're puncturing something.
I have been practicing for 15 years, sir.
Okay.
Without a problem.
Okay.
When practiced properly with the basic understanding of anatomy, unless you are puncturing a major blood vessel, there is no problem. In fact, the needles are smaller than the typical injection syringe needles that you have. Very fine. A lot of times even bleeding doesn't happen when you are inserting and removing that.
Okay.
So acupuncture essentially works on the principle of energy again. It's a Chinese system of medicine, but also there is origin from India. We talk of marma as one of the things. So you're trying to balance that energy using specific acupuncture points. And this can be used again for pain management, to sleep. There are amazing points. There is something near the wrist. There is a point called Heart 7, amnion. And it's very well documented with fMRI studies.
Oh.
That you stimulate that, your reticular activating system kind of calms down, and
so you sleep it.
You sleep better.
Okay.
And I think one major area to work with addiction recovery is sleep.
Yes.
Pain definitely is something that we work on.
Are there any specific acupuncture points for addiction?
Yes, there are.
Oh.
There are. Okay. So again, there are 12 meridians and there are multiple points, about 700 plus points on the body.
Oh.
So you choose the permutation and combination looking at individual conditions and then recommend it.
Okay, okay. And the last part of it is the massages and it's kind of a pressure that you apply, when you talk about massage. The Indian system of medicine, Ayurveda, also has massages as a form of treatment or one of the treatment techniques that they use. How different is massage of a naturopathy, or are they two different, or it's the same?
The answer is yes and no.
Okay.
Massage is a massage.
Yes. Yeah.
But the approach to massage is slightly different than Ayurveda. Ayurveda believes in the medication that is in the oil.
Okay. The way you water and mud that you want it to permeate. Use. Okay.
So in Ayurveda, you're talking of which oil to be used in what condition.
Okay.
For naturopathy, oil is more of a media. Okay. We are not worried too much about the oils. We are more with the manual manipulations.
Okay.
So say you want a metabolic activity to be activated. You have specific manipulations for that. In Ayurveda, it's more of a application of oil that is abhyanga, whereas naturopathy is. But what we have started doing, and S-VYASA does it, I think Cadabams also does it, we go more with integration now. So we take the medicines part from Ayurveda, use the same oil. Anyway, we need a media.
Yes.
We use it for the massages the way we want to do it. And I think the future is definitely in the integration. It's not, Yoga Naturopathy can work in its own silos, and Psychiatry can work in its own silos, or Ayurveda can work in its own silos. The future is definitely putting all this together, and ultimate beneficiary has to be the patient.
Patient. Absolutely. Absolutely. So today we have had a wonderful, but a very lengthy, wonderful discussion about yoga, naturopathy, and how is it useful in cases of addiction specific, but in health general. We dwelled into so many scientific aspects, the studies, scientific evidence studies that is done on impact of yoga, naturopathy, acupuncture on various brain areas, the neurochemistry of the brain, the panchakoshas that we spoke about, the trigunas that we spoke about, and most interestingly, how trigunas have become, you can assess the trigunas, which is a scale which is, developed and used at S-VYASA, where Dr. Apar is the principal of yoga and naturopathy school there. It was a wonderful conversation. So if there is anybody who is looking at want to be healthy, or you have problem of addiction and you want to come out of it, and you like these kind of treatments, do not hesitate. Meet Dr. Apar. He will be able to help you, or reach out to professionals. There are treatment options. There are multiple treatment options, and it will be helpful. Thank you, Dr. Apar. It was a wonderful conversation. I really enjoyed it. I felt I was in a different world, of yoga, so many things. Thank you so much. It was very, very enlightening.
Thank you so much for the opportunity. It was a pleasure, and we work together. Cadabams and S-VYASA are partners, and anywhere, any patient requiring this help, we would be more than happy to support that.
Certainly. Thank you so much. A small, gift from, Cadabam. Thank you so much. Thank you. Thank you. Thank you.